America is reopening as its COVID death toll reaches 100,000. But just weeks ago, so many were dying in New York that bodies were left to rot on the streets.
I'm not going to sugarcoat this in any way. Very upsetting.
I'm Hilary Anderson. For decades, I've worked as a reporter on wars and disasters all over the world. But I never expected to see a crisis of this scale in my own country.
We were looking at a freight train coming across the country. We're now looking at a bullet train.
2 months ago, I began filming my journey to the eye of the storm in New York.
This crisis is completely out of control.
I wanted to know how, in the richest country in the world, 21,000 people could die in one city. And ask, is the rest of America about to repeat the mistakes of New York?
I feel like we need to have a Corona party. I'll bring the Corona.
Rural Vermont, my home. Far, you might think, from today's pandemic. But the virus knows no bounds. It's trickled deep into rural America. Vermont's relatively protected from the virus, but this old people's home right here has had 7 people die in it and 36 test positive, half of them staff. So, you know, this is how bad it is, even in a small, rural part of America. My neighbors are afraid. I've heard of one who's taking the safety of his family to a whole new level. I'm on my way right now to go see a friend who's a dairy farmer. His name's Joel Pominville, and he lives with his mother, who's elderly, and I understand he's taken some pretty extreme precautions to try to protect her.
Thanks, Mom.
Well, see if your soup is hot enough or you want me to heat it a little bit more.
To protect his mother, Joel has built a physical barrier down the middle of their sitting room. Your mom, how did she react when you came up with the idea of the bubble room?
She didn't like it. She doesn't like this whole COVID-19 thing interfering with her life.
Okay.
But who does, right?
Yeah.
But I just feel responsible for her health. Right.
And how long are you planning on leaving this up and using this?
Till we have a vaccine.
Oh, long time. Yeah.
Really?
Well, I'm hoping. Johnson & Johnson said they're
That
going to have
means all summer?
Johnson & Johnson says their vaccine's going to be ready in 8 months. That was a month ago.
8 months? Oh my goodness.
Can you do this for 8 months?
I didn't know that.
With so few people here, it's a relatively easy place to isolate. But New York City is just 5 hours away. I'd begun talking to emergency doctors there. Their stories were disturbing.
So it's absolutely insane. We just had another death in the hospital.
The death toll from coronavirus has jumped dramatically tonight after New York City said it has been undercounting those killed by the disease.
Other countries have higher rates of death, but by April, the United States had overtaken China and Europe as the global epicenter. And now, this was becoming personal.
These are N95 masks that a friend dropped on
My sister is a local GP. She'd decided to volunteer in overstretched COVID wards in New York. I was proud of her, but worried for her too.
So, yeah, I have a friend who works at a inner city hospital in New York, She's told me that the hospital is not safe and that it's a very dire situation. And she's told me that it is like an apocalypse down there.
I wanted to see this crisis for myself. As a journalist, I was allowed to travel. I've covered a lot of wars and conflict all over the world for 25 years, and I've seen a lot of death. But I've never witnessed anything like this in the Western world. Tens of thousands of people have died of this pandemic in a matter of weeks. This was a 300-mile journey on roads that were virtually deserted. Queensbury, a town 3.5 hours north of New York City. And my first glimpse of what was to come. These were the bodies of New Yorkers, ferried out of the city in their hundreds by volunteer David Penipent. So many were dying in April that the city was short of space to cremate them.
In the past 3 weeks, after this week, I have made 600 human remains, brought them to various crematories. Yeah, it's beyond belief down there, what I'm seeing. It's just beyond belief.
Arriving in New York was intimidating. I was driving into the heart of the pandemic. The city's streets were eerie, empty. As I got there, I witnessed what's become the ritual, a cheer for health workers. Here it happens every night.
I got here at 7 o'clock, right as the whole city is doing their evening shouting. It's amazing, you can hear it all around.
This city has seen more COVID deaths than most countries. Around 8,000 people have died in London, which has a similar population. In New York, it's over 21,000, more than 5 times as many deaths as in the whole state of California. Central Park hosts a field hospital.
This is completely surreal. I mean, this is Times Square, the normally throbbing, crazy heartbeat of New York. And it's almost completely quiet here. I'm standing here in the wealthiest nation on earth, the country with some of the best hospitals and scientists in the world. The question is, how did this place become the front line of the global pandemic?
At the start of the crisis, hospitals were closed to visitors and cameras. As pictures emerged, the pressures on staff were clear. So I asked the doctors I'd been talking to, including my sister, if they could catalog their days without disturbing their work or filming patients.
I have a number of patients who are manual laborers, and they're literally bedridden, and you can't even sit them up without them developing labored breathing.
Dr. Rob Gore worked in a COVID emergency ward in Brooklyn. The rising body count was alarming.
Just coming off of one of the toughest shifts that I've had in a long, long time. You know, I've seen quite a few deaths over the past couple of days, and it starts to wear on you.
I've seen a lot of tragedy, I've seen a lot of disaster. I worked in Haiti pre-earthquake and post-earthquake and saw a lot of people dying from illnesses and injuries or complications of injuries. I've never seen anything like that before.
So another day in the COVID crisis.
Many doctors were short of the basic equipment they needed to do their jobs. Dr. Anuj Shah worked across 6 different hospitals in neighboring New Jersey.
Here's the morgue. We're still seeing a lot of deaths in the small hospital, and you get numb to it, you know? We are seeing it so frequently. I didn't want to see another death today. I did not want to see a death today. Never imagined that in this country that we would not have simple like masks and simple gowns, and we would not have IV line. We are like soldiers at the front line. Government and healthcare organizations should have stepped up way more. They should have been prepared for a pandemic.
In March, the rate of new infections began soaring, doubling at times by the day.
We were looking at a freight train coming across the country. We're now looking at a bullet train.
Just 6 weeks earlier, New York's Governor Cuomo, a Democrat, had been dismissive about the threat of the virus.
Catching the flu right now is a much greater risk than anything that has anything to do with coronavirus.
The White House had been warned as early as January that COVID could take 500,000 American lives.
The Trump administration says it will now bar foreign nationals entering the United States if they've been here to China in the
President Trump shut down flights from China in early February. And continued campaigning for November's elections. His message to Americans: relax.
We have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear.
What the president had not done was shut down flights from Europe. That would take 6 more weeks. During that critical period, in February and March, the virus spread across this city unchecked. New York, about twice as crowded as London, the perfect breeding ground. The governor pointed the finger at Washington.
January, February, March, 3 million Europeans travel to New York State. 3 million.
And there was a critical lack of COVID testing. The governor begged the president to help step it up.
The federal government here let the city down. It didn't stop travel from Europe when it should have. It didn't provide access to diagnostic tests when it should have. And because of that, New York City was flying blind. It didn't realize that there were thousands and thousands of infections in February.
In the hospitals, there was fury.
And we're dying here. We're seeing our coworkers die. We can't move forward if we don't look at the errors that we committed in the past. This administration has blood on its hands. Every person that continues to die right now, that falls on the federal government.
But the decision on when to start lockdown in New York belonged not to the president, but to Governor Cuomo. By the time he gave that order, at least 134 New Yorkers had already died. Jeff Shaman, a leading epidemiologist, believes thousands of lives could have been saved in New York had the city locked down earlier.
We've modeled that, and if we were to back it up 10 days or 14 days back from when they locked down ostensibly here when we started to see it, is when the first death occurred in the United States, we see a 10-fold reduction in the number of cases. It didn't have to happen if people were proactive.
Closing New York earlier, before any deaths, would have been a huge call. But San Francisco's leaders did exactly that. San Francisco is a smaller city, not as crowded or poor. Still, fewer than 50 people have died there.
I mean, it has me screaming at the walls in my house. I'm publishing information that actually shows what the problem is. And we were ignored. In February, there was ample evidence that this thing was spreading very aggressively, and that if we had acted earlier and sooner, that we could have ramped up the war production ask, that we could have gotten companies to build test kits and got them deployed en masse and put ourselves in a position to be prepped for us.
A month later, nearly 16,000 people had died. But that's not the whole story. In places like this, parts of Brooklyn and the Bronx, where it's mainly black and Latino, people have died at twice the rate of white New Yorkers. It's crowded and poor here. People are far more likely to suffer ill health. I got a call from David Penepent, the mortuary professor who I'd met in Queensbury. He'd had an emergency and had asked me to meet him at an undertaker's in Brooklyn.
Turn right onto Corona Avenue, then turn left onto 91st Place.
You must be kidding me. And that is just weird, right? Yep, I'm on Corona Avenue. The situation that awaited seemed almost too macabre to be true. These ordinary rental trucks parked on the busy high street contained dozens of bodies. The vans were being used as temporary storage space by the local funeral director, whose chapel already stored over 100.
This is New York City, and there are truckloads of bodies, unrefrigerated, on the side of a road. What this says is that this crisis is completely out of control. There have been many days throughout this when hundreds of people have died in just a 24-hour period. And this is what it's come to.
The crisis only came to light when the neighbors complained about the smell. This grieving daughter couldn't put it into words.
My last visual is watching my mother take her last breath. So right here, this is too much for me. I'm trying to speak to y'all, but I am so clouded right now because it hurts. It hurts. There's no words for hurtfulness.
It was now up to David to move the bodies to a proper place of rest.
Do you find this disturbing at all, what happened here?
Very upsetting. I'm not going to deny it. I'm not going to sugarcoat this in any way. Very upsetting.
What do you say to the families of these people?
I basically say to these families, this is a good funeral director. He just became very overwhelmed, and when he reached out to me, he was almost in tears. Please help me, please help me. His voice was breaking up. He was very, very saddened by what was happening.
Grief has consumed this city. So many relatives of the thousands who died, reliving the trauma, wondering why. Beatriz Nunez is one. She lives here in Brooklyn. In March, her fiancé Jorge began showing COVID symptoms. But there was a shortage of tests in the city, and she says the hospital didn't test him.
He had had a temperature of 106. He was completely delirious, and you still couldn't get him a test?
No. Unless he had to be admitted and intubated, they would not test him.
Hospitals in these parts of New York, overstretched at the best of times, were struggling to cope. Jorge was discharged the same day. He went home in an Uber. The hospital told us it gives all patients the appropriate treatment.
He couldn't even stand up straight. When he came home from the hospital, I could physically carry him upstairs.
At home, a few days later, Jorge's condition still wasn't improving. He asked if he could have a cup of tea.
Which for us was even weird because he is not a tea drinker. And when his mom went to give it to him, because it was already cooled down, I don't know, maybe 10 minutes or so, and she realized he wasn't breathing. And that's when she called me, and I ran to him, and you know, I called 911 and I was doing the CPR, but honestly, in my heart, he was already gone. When she realized that he wasn't breathing, he was already dead.
Jorge died of suspected COVID. He left behind a son, Logan, who was just turning 2.
He doesn't understand, but he for sure knows something's different. He asked for his dad all the time. He was extremely close to his dad. I'm sorry.
Once again, the meals will be here shortly, but come get your hand sanitizer and your face mask.
In the Bronx, New York's poorest borough, a food handout. This area was hit hardest by the disease, and now too by the effects of lockdown. Almost 1 million New Yorkers are out of work. 40 million unemployed across the nation. There's been nothing like this since the Great Depression. Here, many are down to their last pennies.
Usually, when I have no more money left, I come here to the center to get food, or I eat less food.
Let's practice social distancing. Let's practice safety.
The city, still in lockdown, is poised to start slowly reopening next week. Infections in New York have now decreased massively. But over 200 people died here of COVID last week, and many worry about a second wave. It's now 4 weeks since coronavirus cases in New York reached their peak. I've left New York and I'm back on the road. What I saw and learned in New York is really disturbing. The scale of the death, the chaos. But I also understand that if you come from a part of the country that hasn't been as badly affected, you might see things differently. Most states have been in some form of lockdown, but none have been hit on anything like the scale of New York. 10 states have had fewer than 100 deaths. This is New Hampshire. It's not far from New York State, but fewer than 250 people have died here. Wow, this place is open. Amazing. I haven't seen this before. I visited just as lockdown was partially lifted in mid-May. Similarly to the UK, people here had been asked to only leave their homes for essential reasons. And today, finally, a breath of relief. Outdoor markets and many shops and salons are reopening.
That government does not have the right to restrict assemblies of any kind.
But for these protesters, it's not enough. They want everything open, and they want it now.
The restrictions should be lifted completely. There's no state of emergency. We did have one, but the emergency is gone. It's time to get back to normal. Not a new normal, the old normal.
As of yesterday, it's 183,000 people out of work in New Hampshire, out of a working population of 775,000. That's a huge price to pay for these decisions.
We have our freedoms, and we're willing to fight for it if we have to. I love President Trump. I bless him, and I bless his family.
The pace of reopening America has become a massive political issue in an election year.
A lot of Americans are absolutely craving this, a chance to get out into the sunshine, and they want their jobs back. Many are thrilled that the president is saying it's time to open America back up. President Trump has chosen a powerful electioneering message to rally his base.
Until all this, President Trump's strongest electoral card was America's booming economy. But now there are warnings of a 30% downturn, which could be politically devastating. President Trump has signaled his support for these protests from the outset.
These are people expressing their views. I see where they are and I see the way they're working. They seem to be very responsible people to me.
In May, the president supported armed protesters who'd invaded the state capitol in Michigan, where there'd been almost 4,000 COVID deaths, saying the protesters were good people and the governor should give a little.
Yeah, it's crazy.
Mary Revaud, a hairdresser here in New Hampshire, thinks Donald Trump's great. She's just officially opened her salon for the first time since March.
Good morning.
Good morning.
But today, she can only take one customer at a time. Mary's infuriated that the virus is still, months on, cramping her style and killing her business.
So, my love, this is the waiver I have to have everybody sign, so you can't sue me for, coronavirus. I know, it's ridiculous. Perfect.
For Mary, the horror stories of New York are a world away.
Do you remember back in the day, my mom was telling me about this, they used to have chicken pox parties where you'd literally invite every kid in the neighborhood so everybody would get chicken pox
at the same time.
I feel like we need to have a corona party.
I know. And
I'll bring the corona.
Father's Day.
Mary believes the president has handled the pandemic well. The White House has increased testing, outlined science-based guidelines for reopening, and is sending millions of Americans stimulus checks with the president's name on them.
I think most business people realize that he's doing far more than most politicians. Where are the Democrats now? Nobody's helping. I support him 110%. I don't have a lot of people that I know that have been sick. And if the numbers are like they're saying they are, they're obviously all in New York. But why in New York did it get hit so hard? Is it because we have a lot of people that aren't there legally? Is it because we have thousands of people living on top of each other?
The president can exert pressure for America to reopen, but it's state politicians who make the decisions. Representative Tim Lang says they're reopening cautiously here, in line with the science.
Every one of our recommendations are being reviewed by our state epidemiologist, a nonpartisan person who's looking at for strictly public health concerns. If we wanted to open probably a large concert venue with 10,000 seats we talked about, I bet you they would tell us no.
So if the infection numbers go up, you'll start to close down again?
I will say if the numbers go up, the governor will consider moving backwards if necessary.
Now all 50 American states are starting to reopen. In just over half, New Hampshire included, infections are decreasing. But in many states, infections have been steadily rising. On last week's holiday weekend, the beaches were packed, as if none of this had ever happened. Once again, the American scientific community is sounding the alarm.
We have to remember, though, that coming out too soon could set us back, could mean a large resurgence of cases that damages not only lives, but also our economy. We are seeing activities in some places that worry me. People together in enclosed spaces with no face masks on in communities where the virus is spreading. That's a really risky thing to do.
Do you think the pandemic is being politicized by the White House?
I'm very concerned by some of the political aspects that are being layered onto what should be scientific decisions.
Scientists warn that 135,000 Americans may be dead by August. But in the land of the free, each state makes its own choices. Will America learn the lessons of New York? Or will election year politics drown out the scientists, putting America, once again, in peril?